national unity, but also our patriotism to the country. They appreciate the role of the army with regards to maintaining or providing peace and security to the citizens of this country.
Meanwhile, Right Reverend Collins Andako, the Bishop of Madian West Nile Diocese, who was the main celebrant, said UPDF officers should always conduct themselves in a manner that reflects the values and principles of the UPDF.
I want to thank God for Major General Felix, our brigade commander for this division, for coming openly to thank God for what God has done in his life. And to the local people, I will say that Major General Felix has appreciated God and has respected God and has honored God.
Major General Felix Busozori, commander of 4th Division, thanked the people of West Nile region for their cooperation with security in curbing crimes. He added that discipline and professionalism are essential for building trust with the public and ensuring their success in various missions.
Today is a special day, and I'm really honored. I don't know what to say. I'm short of words. Who am I to lift all these big people to come for my function? The whole of West Nile is here. So I'm really honored to be with you while the brigade commander has organized a Thanksgiving for me.
However, Lieutenant Colonel Nathan Baini Obugisha, Brigade Commander West Nile, says UPDF has a strong reputation for discipline and professionalism both within Uganda and internationally. He acknowledged that there have been instances where some officers have fallen short of expected standards.
The purpose for this gathering is Thanksgiving. I like the statement always made by Archbishop of Uganda, who says, and I quote, "When you wake up with God, everything becomes so simple for you."
The Thanksgiving ceremony attracted members of parliament within West Nile region, NRM leaders and other political leaders who graced the occasion. Major General Felix Busizori was promoted from Brigadier General to Major General upon his outstanding services in the UPDF family. Alfred Jawok, West Nile TV, Nilecast.
Moving on with the news bulletin. Now, as the period the reopening of schools nears, government has announced vacancies for teachers in the newly established seed schools across the country. Take a look at the story.
Government has announced that it has started a process that will see it recruit at least 2,821 teachers for 91 seed schools around the country ahead of the new school term. The chairperson of the Education Service Commission, Reverend Professor Dr. Samuel Luboga, said, having advertised these jobs on December 23, 2024, they will close receiving of applications from teachers on January 10th. He mentioned the application receiving centers for the clusters as Gulu, Arua, Soroti, Mbale, and Kololo in Kampala, Hoima, Fort Portal, and Barara. The principal economist in the Ministry of Education and Sports, Derek Namsi, explained that the 91 schools are part of the second batch of seed schools under the Uganda government intergovernmental fiscal transfers program. He explained that each school will recruit 31 staff, including 7 graduate science teachers, to make a total of 637 for the 2,821 schools. He mentioned the same number will be recruited for arts teachers. The schools will also get 364 diploma-holding science teachers and 455 diploma-holding arts teachers. The Secretary of the Education Service Commission, Dr. Osman Lukwago, said they will require 1.3 billion Ugandan shillings to carry out this exercise. This budget, he said, will cater for allowances and transporting of the staff to the various application receiving centers around the country in a bid to beat the deadline for opening of the new term. Officials from the Education Service Commission urged teachers to personally take the applications to the various centers. Mercy Daru, West Nile TV, Nile Cast.
All right, moving on with the news bulletin. Nebia Road Driver Association recently held their annual general meeting, bringing together apartment owners, drivers from across the districts, and this is where they were cautioned against reckless driving. Alfred Jawok has more details to the story.
Nebi Arua Road Drivers Association over the weekend held its annual general meeting at Gaf apartment, bringing together hundreds of drivers from across the district. The meeting was held over the theme promoting safe and efficient transportation aimed to address pressing concerns affecting the driving community, including road safety, traffic congestion, and working conditions. In his keynote address, Obote Charles, Chairman Nebiarua Road Drivers Association, emphasized the importance of unity and cooperation among drivers. He added that they must work together to promote their interests and address the challenges they face.
Achiel watie ko motikare. Motikare wen gitie makanyo ng'ato motie ko permit ki member mo eni wacho okay. Motikare ni no chak si no gmati eni. Aya mongo tie dana matong manango nyo tie ko motikare kin pasho gi. Ma bini banga nyo nendra ng'ato mo kitebe tie ko motikare para. Aya achiel eni kene go mikindo mo ko butie ko NGOs de magi be driving munge umodi business bitimo ne munge chala luor gi muguti kudukane gi mare we wilu ngoni association partika bunyo ma wade cross karashel mashalo tin mo biro karashel.
The meeting featured presentations from various stakeholders, including the Uganda Police Force and political leaders who encouraged the drivers to embrace discipline on the road. One of the key resolutions passed during the meeting was the establishment of Drivers' Welfare Fund to support members in times of need. In his closing remarks, Honorable Hashim Suleiman, Member of Parliament in the municipality, who was the chief guest, thanked the drivers for their participation and commitment to the association. He said together they can make a difference and create a better working environment for all drivers in the municipality.
Drivers Association, Drivers and Brake Association, they have organized a day for them today to sit and celebrate the end of the year and also enter the new year. So they thought it wise that I should accompany them, be with them in this celebration as their leader and as their area member of parliament. I think that is a very good credit to me and achievement to me. And that if your people want you really to come down to them and celebrate with them together, I feel proud of that. And it has been a very good occasion because many speeches were made. They gave opportunity for many leaders to talk. The mayor talked, the DPC talked, and their own leaders talked. Our chair party, talked, and it was so good. They gave very educative and advisory messages to them, how they should really handle the road, because in most cases they are handling the road, their drivers. And personally, I in fact told them and guided them how they should behave as drivers.
The association, which started in 2019 to bring together unemployed youths, has over 134 registered members. Alfred Jawok, West Nile TV, Nilecast.
To continue with the news bulletin, now moving on to Moyo District. The district is still grappling with the challenge of bad roads, something the leaders blamed on continuous and long-term breakdown of road equipments within the district, as Anthony Okumu has more details to the story.
The district since last financial year planned to carry out rehabilitation works on a number of road links, but however most of the planned road rehabilitation works have stalled due to the constant breakdown of the road equipment, which in most cases takes months to be fixed. Anyama Williams, the chairman Local Council 5 Moyo, while giving report on road works during a recent council meeting, said the district had planned to carry out rehabilitation works on a number of roads but with little success. He however tasked the office of the chief administrative officer to take charge and ensure the road rehabilitation works are done so as to improve the road network within the district.
Opiro Horokomba Road, Leforikali Road, Leforitini Road, currently working on Metu Gopi Road and Padigalogoba roads respectively. The biggest problems have been in complete drainage works and culvert works, especially in Lefori. Lefori still has issues with the drainage works. And Mr. Cow, this is the responsibility that needs to be taken up and fixed. Otherwise, the road work was done well, the maram is of good quality, but the drainage work and culvert works were done poorly. It is an area that we must work on very seriously. Again, Mr. Speaker, Dufele Ara Road has not been started. It is a responsibility that has to be carried on. Efforts are being made to ensure all the planned road works for last financial year are accomplished.
Bada Emmanuel, the district councillor representing Moyo sub-county to the district council, said he is concerned about the road links being left unattended to, yet these road links were fully funded and were supposed to have been worked on in the last financial year.
The concern I have here is that a number of road links that were supposed to be completed within last financial year, up to date, have never been completed. And yet 100% financing has been done to this department. We have the district roads committee, and we are in the second quarter. Mr. Radis, you interest yourself on this matter. We are in the second quarter of the new financial year, but the road works of the last financial year have never been completed. The case in point is Logoba Pajiga. Even if you go now, near Logoba Primary, you will find the culverts line. And this is the road for last financial year.
Asusi J. Bissam, the Secretary Finance and Production, Moyo District Local Government, registered his disappointment to the Works Department for the delay in rehabilitating the road links, but however blamed the delay on the continuous breakdown of the road equipments, saying the road equipments had broken down for close to 8 months ever since the road rehabilitation works was launched last financial year, hence affecting the rehabilitation works within the district.
That disappointment is a disappointment of executive. But the issue is also the breakage of these machines, the road equipment. As I talk, the road equipment stayed in metal for now over 3 months, for only 1.5 road links. The wheel loader is down, and if the wheel loader is down, they cannot even dump Mara. A particular Lokoba road network is completed. Otherwise, we are really concerned about the delay work. They are still doing most of the work is for last financial year. The machines stayed in Lefort for over 5 months.
Dominic Anthony Okumu, West Nile TV, Nile Cast.
Moving on, one of the key lawyers in opposition figure Kiza Besige's trial in the names of Aaron Kiza was this week sentenced to 9 months in prison by the General Court Martial sitting in Machindi. Take a look at the story.
The General Court Martial has sentenced lawyer Aaron Kiza to 9 months in prison for what it termed as gross professional misconduct. Mr. Kiza, one of the key lawyers in opposition figure Kiza Besige's trial before the military court, was found guilty of banging the angle bars and didn't listen to the chairman of the court. He has been ordered locked up at Shitala prison. Mr. Kiza, who was in the morning thrown into the gauge dock where his clients Besige and his associate Obed Lutale was brought to the court after the launch adjournment in handcuffs. Mr. Samuel Muizi, another defense lawyer, said Mr. Kiza had been tortured during the break and that his arm was dislocated. His sentence was passed without a trial, contrary to basic principles of justice system, even in a military court. With deep concerns over the conduct of military court that was largely seen as kangaroo by critics, The sentencing of Mr. Kiza without a hearing will be seen as a major abuse of the fundamental rights of the lawyer. Critics have urged for years that the military court has no jurisdiction to try civilians and that military men treat civilians like military personnel when in the court-martial. The controversial jailing of Mr. Kiza, who has clashed with Judge Advocate Brigadier General Richard Tukachungura over procedural matters, could have the judiciary on the ropes after the Supreme Court failed to rule on an appeal against the Constitutional Court's stripping of military courts of the right to try civilians. Masidaru, West Nile TV, Nilecast.
To continue with the news bulletin, as the situation of malaria continues to worsen in the country, Maracha District in the West Nile sub-region has launched its indoor residual spray under the theme Instituting Malaria Smart Home Strategy as a gateway from malaria eradication in curbing the situation. This happened on the 7th of January 2025. Benson Pastore has more details to this story.
As the situation of malaria continues to worsen in the country, Maracha District in West Nile region has launched its indoor residual spray under the theme Instituting Malaria Smart Home Strategy as a gateway for malaria eradication in curbing the situation. This happened on 7th of January 2025 at Ibura Primary School playground in Maracha District, attracting different stakeholders such as health officers, government officials, community members, among others. Daru Jessica, Assistant District Health Officer for Maracha District, says Maracha is one of the beneficiaries of the intervention because of the high cases of malaria in the district.
Maracha District local government is one of the districts that has benefited from indoor residual spraying. That is the IRS in short, and we've been using it in a way to reduce malaria in the district. This is the third time we have implemented this specific intervention. And why Maracha has been chosen among all other districts is because Maracha has a very high burden of malaria in the district. And since we started having this intervention of IRS, we have seen malaria reducing drastically actually.
Whereas Ale Madiki, Maracha District Secretary in charge of social services, laments by saying the IRS intervention has positively impacted in curbing the malaria situation in the district.
Initially, Maracha used to stand at 53% cases of sicknesses in facilities, health facilities. Those were reported to be malaria. But the first IRS, which was done in 2022, helped us, but people did not realize the impact so much. But now, when we reached last year, that is 2023, the chemical was changed. This time we now use acrylic, which has so much helped, and we still have issues despite the intervention of the government through IRS. We still have issues in the community, the mindset of the people. There are still community members that believe through going for prayers they can still treat malaria. There are people who still have believed that when they go to witch doctors, they can still get medication for malaria, which is a myth.
Meanwhile, Moreno Rodrigo, the coordinator Picot Maracha District, highlights the audience with the activities they perform, more so the procedures of performing their duties.
We are contributing to the national goal and therefore strengthening the health system in Maracha District local government. Our interventions are basically on malaria reduction, and our mode of intervention is on ICCM, that is Integrated Community Case Management. We work very closely with our VHTs. There are so many other activities that PICOT has always been supporting the district with, and I am obliged and very happy through the office of the cow that they gave us very conducive working environment to see that the different projects that are supported by TASO and then PMI are successfully implemented.
Dramani Collins, Assistant Resident District Commissioner Marta District, thanked the various stakeholders for the brilliant initiative, more so highlights on the challenges they still continue to encounter in fighting the disease.
I first of all want to thank the President for having put so many initiatives to ensure that malaria is eliminated in this country. I also want to thank the Health Department of the district for always implementing the presidential directives to ensure that malaria is eliminated in this country perfectly. I also want to thank the communities for always supporting the government programs, especially the initiatives to ensure that malaria is eliminated at a certain period of time. That is to say by 2030. Besides all those challenges, besides all those achievements that people are trying to put in place, there is still challenge of misconception of some local people in our place. One, the issue of witch doctors. The issue of people believing that there's no malaria, which has been propelled by some people who don't believe that malaria is in existence. Secondly, there are those who believe that they can only be treated by witch doctors. This is something which is too big for us as leaders of this nation, as leaders of Marata, as leaders of this country, that we all need to come on board to ensure that we sensitize our people against the issue of propelling misconception.
In the last quarter, Marta District registered over 168,000 malaria cases compared to the previous quarters, in which the district registered over 500,000 malaria cases, indicating that IRS has drastically reduced the malaria cases in the district. Oraku Benson Pastore, West Nile Television Nilecast.
Moving on, Nebi District Local Government on the 8th of January 2025 commissioned a brand new ambulance and a motorcycle, as this is expected to improve on service delivery. Alfred Jawok has more details to the story.
Nebi District Local Government has today 8th January 2025 commissioned a brand new ambulance and motorcycle to enhance health care services and transportation in the health sector. This milestone event is a significant step forward in improving the district's emergency response capabilities in helping blood donations. The ambulance, which was officially handed over to the district's health department, is equipped with state-of-the-art medical equipment to provide quality health care services to the community. This includes emergency response equipment, patient transportation facilities, and basic life support systems. In addition to the ambulance, the district also commissioned a motorcycle to facilitate easy transportation of healthcare workers and medical supplies to remote areas. Honorable Emmanuel Rombi, Nebi District Chairperson, said this will enable healthcare professionals to reach patients in need of blood more quickly and efficiently.
To mobilize, because there's a new blood center, but I want to thank also UNICEF and AFSI. They have given us very big refrigerator. That is what we are using for screening now. Then also, Nebi laboratory right now is what we brag of. It's a 5-star laboratory now, which means we can do all this testing of the blood from here, confirmatory test from here. Now we have a blood distribution center, but the problem has been also on logistical issues that when we go to mobilize, how do we go? Because there are no vehicles, and we have been gambling. Sometimes they will use my personal vehicle, sometimes they will use the one for hospitals, sometimes for DHO. Even RDC will give us, including CAF. And until in 2020, we increased on our advocacy, and that's when we started up this thing. We started this blood collection center and distribution using our double cabins and the rest, but they said it's not healthy enough, and that's why now we wrote a proposal to UNICEF, and UNICEF gave us a Land Cruiser, though they were a bit old. They gave us 2, but one we deployed there. But he did not stop on our advocacy with a blood bank, and until by end of last year, that's when we were given this Land Cruiser. And Land Cruiser with they gave us also motorbike.
According to Honorable Rombi, the commissioning of the ambulance and motorcycle is a testament to Nebi District commitment to improving the health and well-being of its residents.
Blood collection center, and is performing so well, because their performance, they always rank which district is performing well, and also which region, and so forth. So we have been collecting blood, and all this blood, when they are tested, they are redeposited back to Navy. And this is why you have had the cases of referral has reduced. So today we have commissioned one motorbike, Boxer. That one will be used for the community facilitator to run and mobilize people. Then also we have commissioned one ambulance, and this ambulance is going to help us run, Land Cruiser. Land Cruiser is going to help us as a van to run around, mobilize, and also collect this blood. And I think our people will be safe, especially pregnant mothers and also accident cases. Otherwise, thank you so much. We thank you so much for always airing our view and other opinions. And thanks for the support. Thank you, Blood Bank. Thank you, Arua Regional Office. Thank you, Government of Uganda. God bless you.
However, Dr. Emmanuel Onapa, Medical Superintendent, Navy General Hospital, added that investing in modern healthcare infrastructure, the district is taking a proactive approach to addressing the healthcare needs of its community.
We are so glad today that at the end of last year, Uganda Blood Transfusion Services bought a new vehicle, a Land Cruiser, and a motorcycle, which is going to be used for blood collection and associated services. So today, as in the district local government, we are glad that the vehicle and the motorcycle was commissioned for use, and we want to thank the government of Uganda, but also the district local government for the great collaboration. So the vehicle is going to be under use in the hospital here, but it will be used to collect the blood from neighboring districts.
The ambulance registration number UG31000349, which was donated by the Minister of Health, will be stationed at Navy General Hospital and a Blood Bank Navy Station to help Greater Navy districts. Alfred Jawok, West Nile TV, Nilecast.
All right, moving on with the news bulletin as we come closer to the end. This week wasn't also really a very good one for the country, as Kawempe North Member of Parliament, Honorable Muhammad Segirinya, was on Thursday this week pronounced dead after battling a long illness. Segirinya, who was also really the Member of Parliament for Kawempe North, was pronounced dead, where mixed reactions were generated. Take a look.
Navy District Local Government as today 8th January 2025.
Lubaga Hospital in Kampala today, Thursday 9th January 2025, announced the death of Kawempe North MP Muhammad Segirinya. According to the hospital, Segirinya has been under the dedicated care of the medical team at Lubaga Hospital. Despite all efforts to ensure his recovery, he passed away today, Thursday 9th January 2025 at 12:10 p.m. On behalf of the hospital, they extended a heartfelt condolences to the Parliament of Uganda, the Speaker, the Deputy Speaker, honorable members of Parliament, his family, and the people of Kawempe North, whom he represented with passion and commitment. Muhammad Segirinya died at 37. He was elected to Parliament in 2021 general election before he was arrested a year later. Segirinya has been pinned to hospital beds in Uganda, Kenya, and the Netherlands following his release from prison, where he and his Machindi West counterpart Alan Sewanyana spent over 500 days on remand after they were arrested over machete attacks in Greater Masaka sub-region, which left 20 people dead. Parliament will hold a special sitting tomorrow 10 a.m. to pay tribute to Segirinya. Masidraru, West Nile TV, Nilecast.
Moving away from that, may his soul rest in eternal peace, but also still within the region is still mourning the demise of former Koboko Municipality Woman in Parliament, Honorable Babadiri, also who died this week, whose burial arrangements are in place. I want to solely wish her and the people of Koboko and the entire country at large, may her soul rest in eternal peace. And that brings us to the end of today's Nilecast Weekly News Roundup, where we give you a recap of some of the stories that transpired in the due course of the week. And we shall still be keeping you posted in the coming week. Have a good night. My name is Farish Majid. I'm out.